The final paper is really kind of the culmination of those awareness building exercises in the writing assignments, combined with all of the knowledge that we're building, and you're going to apply it to yourself. So right now, and this is as we're shifting to, we're looking more at, we've been covering generally the kind of overall look at the interpersonal theory. Then we've been considering some really important client factors, how we can assist the client. And now we're really looking at developing a treatment focus. So we're kind of bringing up all this information, and now we're honing it in to say, okay, well, how do we actually help clients? What do we need to be paying attention to? What do we need to be doing in session? I can move these so that you're not squished. So that's what this paper is about. And so we have our quiz on Thursday. Next week we'll continue on 6, and we'll have presentations. We'll do another role play next Thursday. Is that right? Yep. Then we'll move on to chapter 7. So that quiz is bumped to Tuesday, April 2nd. The past authoring is due on April 4th at 9 a.m. The next April 9th we have that quiz. That's bumped. We'll do another role play. On the 16th, another quiz, and then we'll be finishing out the semester. Let's prioritize here. So what these two sheets are, this is the guidelines for treatment planning, and I've also included the note, guidelines for process note. This is more just in addition. So you really don't need this for class. We're not going to use this progress note. But I wanted to print it out and give it to you. Also, there's a download on Canvas so that you guys would have access to it. So you could see, okay, how do we actually kind of use this in session? What are the things that we're doing in session? I think one of the great challenges, and this is probably my learning curve right now as a therapist and a clinician, is learning how to make taking process notes not just administrative BS that we have to do. It's trying to learn, okay, how do we take process notes in a way that actually influences and builds on our therapeutic treatments. Oftentimes the outlines for process notes, they just don't really build on what we're actually doing in sessions, right? It's kind of like we're writing the process note for the insurance companies, but it doesn't always really connect. And so this outline for the process note, I think, is a nice bridge between that. So I think as you guys are continuing as clinicians, continuing to grow, this is something that I would really recommend saving, continuing to refer to. But let's look at the guidelines for treatment planning. So I don't have the, this will all be, APA 7 or 8 or 9, the formatting. I will upload a sheet that actually includes the format specifics for you guys later on pretty soon here. You guys can probably tell that I'm more of a spirit of the law guy than a letter of the law guy. So, if your heading is off, I'm not going to tar and feather you. Really what we're looking at is the content here. So one of the greatest goals of this class or of the kind of overall class is to help you all to understand how to conceptualize clients, to be able to take your interactions with a client and match the things that you're doing in session to this client, right? Client response specificity talks about what is the relational experience that this person needs in order to change. And so part of therapy is creating a case conceptualization. This is going to begin from when somebody fills out an intake form, an initial questionnaire. This is going to begin from your first conversation, right? We are creating a working hypothesis about what is the nature of the client's issues, what's bringing the client in, how do those issues present in the here and now between myself and the client, how does the client describe them with other people in their life, what type of experience does this client need? So the paper that you guys will be writing is a treatment plan on yourself. So you'll essentially be taking the information from those writing assignments, and it's not really taking the information because it doesn't quite, like, you can't really copy and paste it. Like, it's pretty different. But as you guys have been doing this looking towards the future assignment, as you guys have been looking at your present, your virtues and your vices, your strengths and your faults, as you will be looking at your past in difficult moments and difficult times and writing through them, you'll hopefully be learning a lot about yourselves. And in that learning, you're going to actually translate that to a case conceptualization. So essentially, the framework is that you are writing a case conceptualization for yourself from the perspective of yourself as a therapist in about 5 years. Right? So you're considering, okay, in 5 years, I'm going to be a therapist, whether you intend to be a therapist or not, forcing you to consider it. So, we can put a foot in that door if you're not considering to be a therapist. Always, bring you into the party. You're considering in 5 years, if I'm a therapist and I'm treating myself now, what's the case conceptualization that I would create? So you're going to look at what are the formulation of the problem. What are the client's problems? Why is the client seeking treatment now? This is a really valuable question. This is one of the first questions that I usually ask people in that initial session. Why now? What's changed? Typically, people deal with problems for years on years on years on years on years, and the specifics of why now is really important. Oh, my girlfriend just said that she wouldn't date me if I didn't start doing therapy, if I didn't take care of these issues. Oh, well, I just lost my job, like, just now. Like, that's pretty valuable, information. Oh, well, this crisis happened, right? And so usually you'll see those things, and that's all going to inform how you approach this client. What organizing themes or history characterize the most important experiences with others? So you're listening to the messages that the clients say about other people, right? My mom won't get off my back. My husband never listens to me. My wife is uber controlling, right? My kids don't listen to my authority. They don't respect me. All this is telling you little bits and pieces, and we call it a working hypothesis because we're not taking someone and judging them and putting them in a box. It's not that at all. Rather, we're sitting and as they're telling us, we're just kind of picking up on these different data points. And as we continue, we'll see, okay, do the data support that? Are there more data points in this area? Or maybe not. And then looking at the treatment focus. Remember that we don't have to get caught up in the content. That's actually probably one of the worst things that we can do. We're seeking to pay attention to the process. How does this client interact with me? How does that match other relationships in their life? And so we're looking at what are the maladaptive relational patterns, the beliefs that recur for this client. Thinking of the client's internal working models, ask yourself these questions. What does the client want from others? Do they want autonomy? Do they want freedom? Do they want space? Do they want support? Right? If a client comes in and says, my mom is just overbearing, she won't ever give me she won't give me a breath, she won't give me any space, I'm going to relate to that client in a lot different of a way than if somebody comes in and says, I'm just exhausted, I can't do it anymore, nobody has my back, right? For the second client, I'm going to really try to welcome them in. I'm going to actually try to create closeness between us in that first session. Whereas for the first client, I'm going to say, okay, you've had people in your life that have been all hands-on, you don't have a lot of space, I'd love to do something different here. Today, right now, how can we make sure you have the space here? I've got some questions that I want to ask you about just so I can understand what's bringing you into therapy. But I also want to make sure that whatever way I'm asking them, from the beginning, me and you, we're starting off making this experience here between me and you different than all those other ones. If we don't do that, this isn't going to work. But maybe if you can experience me different than all the people in your life that are overly controlling, we can do something differently. And I might ask, so first of all, if you feel controlled by me, if you feel stifled by me, would you be able to tell me? You may say, oh yeah, I have no issue telling you. Or they may say, no, I wouldn't want to upset you. I wouldn't want to hurt your feelings, right? Then we explore that. But initially, right off the bat, we're creating this working hypothesis. We're kind of introducing it with the client. We're subtly creating gaps to say, like, okay, let's do it differently here. Sometimes we say that explicitly, but more often than not, we're trying to show and not tell. What does this client expect from others? What's the client experience of self in relationship to others? What are the conflicted feelings that are typical for this client, right? One part of me really wants to be close to my caregivers. And another part of me is tired of getting just completely enveloped in their emotions. That push-pull. What interpersonal coping strategies are characteristic for this client? To comply and to go along with, to withdraw, to say I don't need others, to dominate, to take control. And what do these coping strategies tend to elicit from the therapist and others? Disinterest, advice giving. Use your responses to these questions to identify 2 or 3 primary treatment focuses that clarify what's wrong and what needs changing for this client. So here, I don't expect you guys to bullet point this out 1, 2, 3, 4, 5, 6. I do expect you to answer each of these points, but it will be in a narrative format. Again, our clients have learned interpersonal styles of relating, and those interpersonal styles of relating have complementary responses, right? So if a client comes in and says, I'm helpless, I don't know what to do, I needed to be taken care of, right? What's likely the complementary response going to be? What's the opposite side of that puzzle piece?
Let them figure it out on their own.
Do you think that's what most people do for this client?
I thought you were asking what, like, the opposite.
That would be the opposite. What would be the complement?
Oh. I mean, working with them, but not
I guess this.
doing all the work for them.
What is it likely that this client pulls from other people when they're in relationships? When this client shows up and they're super distressed, what's the likely response that others tend to give them?
Like they rely on dependency on them.
Right. So how, if I come up to you and I'm, oh my gosh, I'm falling apart, the sky is falling, what are you likely going to respond? Now there's a lot of different ways, and a lot of it depends on your personal history. But what's the kind of typical thing that somebody's neediness will pull? You're going to help them. Right? You're going to help them, right? So this client showing up and help me, I'm likely going to feel this automatic urge, right? That's an eliciting pull to step in and help them. Now, I'm not saying, oh no, I can't help you, I'm a therapist, right? We're not like eschewing their needs. But we can use that as a dating point. Oftentimes in the beginning of therapy, we are actually joining in consciously, but we're actually joining in with the client's defenses. So a client that's dependent, we're going to join in and allow them to develop some dependence on us because they need some trust. But gradually, right, we're going to help them to grow in independence. And so the other side, right, we think of somebody who's hostile or aggressive. If somebody comes in and starts barking at you and say, do this, what's the complementary position of somebody who's aggressive? What response is that likely going to elicit from others?
Make others angry.
So that would be the opposite response. That wouldn't be match. Wouldn't quite be a compliment, right? That's going to happen a lot, but actually it probably happens a lot less than we think, right? Because oftentimes being angry with people isn't a safe thing.
So just be like acting calm around them, like not like reassurance, but like
Somebody comes in and starts barking at you, telling you what to do. If it's not going to elicit anger, which it likely will for a lot of people, what are you going to do?
meet them where they're at.
Think about it in an more everyday example. You're going to submit, right? So the complementary position to control is submission, right? And so if a client comes in and is like, oh, well, I want to do it this way. I want to start the session this way. I want to start the session this way. That tells you that this client is probably used to other people submitting to them because they're a bully. Right? So that doesn't mean you say, oh, I'm not going to do that here. That's not going to happen here, right? That would actually be a super big turnoff for the client. You probably wouldn't retain them. But it means I'm going to learn how to respond to that well, but take note, okay, this client probably elicits submission from people. This is probably an effective way that this client manages anxiety. When there's anxiety, I grab onto control, and I tell people what to do, and they listen. But likely that's the very thing that's causing this client depression, disconnection, discontent. And so the developmental context, and we're going to get into that in chapter 6. What are the familial and cultural issues that have shaped the client's presenting problems and worldview? How did the family nurture, discipline, and communicate? In other words, how did the client's early maladaptive schemas, interpersonal coping strategies, and attachment styles develop? Each person we've talked about has a unique story. And if we understand the story of that person, their symptoms make sense. That same thing goes for each family, right? And each family is a part of a broader culture. So it's very important for us to understand the strengths of each culture, that the cultural context of the client, and the weaknesses. We're not here to judge and to shun and to say one culture is better than the other. We're not here to tell our clients how to live or how to act. We're seeking to understand the client and then empower them to act in a way that seems congruent. Right? So oftentimes, one of the best things we can do, for example, in the States, I often work with Hispanic clients, right? And there's a very different cultural expectation for how Hispanic clients relate to their families than how Americans relate to their families. Americans are typically independent, right? I was talking to one of my colleagues and friends the other day, and she said, when I moved to Steubenville and I saw that you and my buddy Mike had graduated and your parents lived here, but you were living in a house different than your parents, I was like, that doesn't make sense to me. Like, what are you doing? Why aren't you living with your families? Just because it's different norms, right? It's very easy, maybe for me, to hop in and say, oh, that's enmeshment, right? Oh, that's too close. Oh, like, you should be independent from your families. But that's me imposing my worldview on them. And so one of the best things that we can do is ask clients to identify members of their family or people in their culture and say, who are the people in your culture that navigate this well? Who are the people in your culture that you know? Who are the people in your family that you know that seem to have a good balance between the type of independence you want and the type of connection you want? Right? So we are norming each person's experience to their culture. And as therapists, we don't have to know everything about every culture, but there is a certain responsibility that we have to inform ourselves and to open up our ears. That doesn't mean that we constantly have to know everything about every culture, but we do need to put a little bit of extra effort in understanding the various cultural norms, especially if there's subgroups that we often work with. But the other thing, again, is just ask, right? If the client is telling us something and we don't understand where it's coming from, just say, hey, this seems really important to you, but I'm not sure I'm quite getting it. What's the cultural significance here, right? What's the familial significance here? And of course, that developmental context, part of it is cultural, but also the huge part of it is attachment. That's what we're looking at. What is this person's internal working models, how they develop? The therapeutic process. Describe the quality of the working alliance that you have with the client in your interactions together. How are you trying to make the client's relational experience with you a repair or to disconform problematic experiences in relationships? When the client is distressed, how does he or she tend to misperceive and react to you? Have you been able to address the potential problems between you and work through rupture or repair episodes? Here, you're going to have to use your imagination. Right, so you're going to have to use your imagination of you in about 5 years as a therapist, and the key here is, right, your own internal working models are going to be triggered by you and the client. Right? This is one of the things that we talk about. There's going to be like kind of an over-identification with yourself. But we're looking at what are the typical ways that you now would pull your therapist to help you when you're distressed. Do you amplify your distress, or do you dismiss and push it down? Do you ask for help and then say, actually, that won't work? Or do you have to always be right all the time and know every single answer? Right? Do you criticize and blame when you feel shame? Or do you get stuck in this pit of despair and hopelessness? And how does that all affect the working alliance? And then you've identified your, for goals and interventions, the 3 treatment issues, and number 2, how you plan to address these. Again, the question is, where do you want to go, and how are you going to get there? What relational experience does this client need? How are you going to produce that for the client? And then impediments to change. And this is a very important section. Don't write this off as, oh, it's just the last section. It doesn't really matter. Anticipate why treatment could fail. If you were to terminate prematurely or treatment is not successful, what factors might contribute? What characteristics are most likely to impede a strong working alliance? Significant family, personal, cultural factors that make it difficult for the client to acknowledge having problems or asking for help, right? So one of the biggest things that leads to clients dropping out of therapy is that they don't feel comfortable to say, like, hey, this therapy is not working for me. I don't really like it. We need to help the client to express their frustrations, their irritations, their ambivalence, their conflicted feelings, their frustrations towards the therapist. If we are not able to aid the client in expressing their frustrations with us, treatment will be limited. And on the larger scale, people will feel like it's not working. If people can't express what's not working, how can we address it? That's one of the things that I often say, is that in order for this to work, it really has to be a collaboration. It has to be us together. Suggest how the client's maladaptive relational patterns with others could subtly be reenacted with you in the therapeutic relationship. And so here as well, what I want you all to consider in each of these sections is you're looking at yourself as a client, right? But also considering yourself as the therapist, right? How might you as the therapist reenact these things? How might you as a therapist struggle with this developmental context? What are your thoughts, questions as we're kind of going through the guidelines for treatment planning, looking towards the final paper?
You've mentioned that in therapy, a lot of the work is like between the relationship or about the relationship between the therapist and the client, and like, yeah, the context is important, but like it's not everything. And so when we're doing this, obviously we're looking back at like our past. Do you want it to be like kind of like an internal dialogue, like with ourselves, of like how would I respond a few years ago versus how would I respond in a few years, or would it be more focused on the context?
So the client is you now. Okay, so the client is you now as you are, right? We're saying you're going to therapy, right? But the viewpoint, the vantage point, the person who's viewing you now is you in 5 years as a therapist. Yeah. The goal is for you to use yourself to develop your conceptualization skills. And the reason we're saying you in 5 years, it's to just give you a little bit of space so that you're not, because this is written, a therapist writes this, right? So the therapist that's writing this is you in 5 years. But it's the client is you right now. Does that make sense? Yeah.
So it could be written in like third person?
Yeah, you'll write the client presents with blah, 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 blah. Becca is, 21-year-old Caucasian female coming to therapy for X, Y, or Z. And then you'll talk about, developmental history and all that. Yeah. When we're writing notes as therapists, we don't say I, and we don't typically use the client's name, although unless you can, but it's always the client. The client and the therapist is, when I'm writing a note, I say therapist provided healing, whatever it is. Yeah. Other questions, thoughts?
Is there like a page length requirement?
Yes, I think it will be. I wrote my notes. I don't remember exactly, but I think it's something like 5 to 7 pages. Yeah.
How should we address like our person now's like attitude towards therapy? Like
Whatever your attitude towards therapy is.
like what you feel like you probably would be like if you haven't been to therapy before. Like
Nope, I want you to say like I'm going to therapy. Like I want you to like when you're writing this, I want you to sit down and be like, I just scheduled my appointment for next week. Now you don't actually have to do that, although I would highly recommend that you do because you should all be therapy if you want to be therapists. You should all be therapy. Be therapy, like Anthony Fauci is science, right? You should look at it as though I am, like make it real as possible. I'm going to therapy, and this is how it's going to feel, right? The thought experiment is, okay, if I was actually in therapy, not like, what would the best me who's going to therapy, like I'm here to change and grow, right? I'm sure many of you have been and are in therapy. I'm sure many of you haven't, right? And it's like, oh, I don't need therapy because I take care of everybody else's problems and have learned to be emotionally connected because I never had the connection that I needed for some reason, so I'm okay, right? That's kind of that's the template, I feel like, typically. But make it real. It's like make it as real as possible. Make it like a real life simulation of like, if I sat down in a chair in the office and I said like, this is what I'm coming in for. Maybe, right, it'll be relevant. Maybe if you wouldn't want to do that, it would be relevant to say, client is presenting because somebody in his life told him he had to go to therapy. Right, so that would probably be a pretty good context for many of you who maybe don't want to go to therapy. So include that in there of, the client's whatever, professor told them that they had to go to therapy. And there's ambivalence of why they're here, whatever it might be.
Does it have to be formatted like this, like the 1, 2, 3, 4, 5, 6?
No, you will have headings.
Okay.
You will have, those will be your, but it doesn't have to have that format. The headings, though, will be the numbers. Yeah, you won't have to put the numbers in there, though. Yeah, and I'll provide you with a template for the format, but it'll all be APA. Yeah.
So are we, like the information that we're taking about ourselves, is it all going to be from the Jordan Peterson thing, or are we like filling in the gaps with what we know about ourselves?
Yeah, you're filling in the gaps. Yeah, that information. Think of it as this. That kind of the Jordan Peterson, the self-authoring is like you're just stirring up the pot of self-awareness, and then the pot of self-awareness is stirred up, and then you're like sitting down to write this.
So are we basically imagining that we have had a session with ourselves and we're imagining what we would have said as a client?
Yes. Yeah. So making it as real as possible. It's like I'm going to therapy. So you have to consider why you're going to therapy, right? Because that's the presenting problem, right? And then in this session, what are the things that the therapist is seeing? Make it as real as possible and as little hypothetical as possible. Obviously, it's a thought experiment, so the whole basis of this is hypothetical. But try to really put yourself in the position of like what it would be like for you to be in therapy, what you would see if you were seeing yourself in therapy.
So we're writing as though this is our first time ever being in therapy, like this is our first therapy session, or like we're writing as though we've been in therapy multiple times?
If you've been in therapy before, then that should be included in the template that, This person was in therapy for 3 months. They're seeking, therapy now. But you're looking at, you've been in at least in order to write a case conceptualization, you have to have at least one session. But consider kind of 1 to 3 sessions, likely. Yeah.
So we're writing it, just like clarifying again, we're writing it from the perspective of, as if the therapist was talking to us, and kind of what we think we present to the therapist.
Yes.
Not kind of as a look inside, because obviously we know all of like the little interconnections of how we think, and the therapist might not get that right off the bat. It's just kind of what we present. So we're writing about
Right.
what we think we would present to the person in front of us, instead of kind of everything that's actually like going on in there. Does that make sense?
Yeah, you don't have to pretend like you don't know things about yourself.
Okay, right.
Like play to that strength. The whole purpose here is to articulate the self-awareness that you've developed in the clinical language. So you're gonna know more than you would know in one session. But also you might be surprised with how you realize you might expect to be in the first session, right? So, when I started therapy, I thought I was like, oh, I'm gonna sit there and open up, and I know what I'm doing, blah, blah, blah. And I sat there and I was across from my therapist and I was like, I don't want to tell this guy a damn thing. I didn't expect that, right? So like really put yourself in that place. And I realized, and guess what? That's what I said to my therapist. I was like, I thought I would feel really open, and I'm here right now, and I feel totally closed off, and I don't really trust you, and I don't really feel like opening up. Right? And that's where we began. So be honest and real. Again, it will be really easy to kind of like think of ourselves in this glorious light of I'm doing this and all these, but the goal of this assignment is not to cut you down, but it's to be like realistically, what defenses would come out, right? Maybe it's, I know that I'm gonna try to make the therapist like me. I'm gonna try to take care of the therapist. I'm gonna try to figure out what does the client want me to do, how do I need to perform, and then I'm gonna try to do it. Yeah. Other questions? Cool. So, let's do it. Let's pair up for listening practice. Cool? So you guys will pair up with whoever's closest to you or whoever you want, really. And we will take turns being speaker and listener. How much longer do we have? It's 10 and we go till 45, so that's 35 minutes. So we'll probably go about 15 minutes and then flip. Let's see what the reflection is on in this chapter. What we'll be talking about. And what I want you all to practice here as the listener is just reflecting. Reflecting back what you're understanding, reflecting back what you're hearing. Listen for points of entry, right? But really what I want you guys to practice here is simply reflecting back. Use open-ended questions, right? Avoid closed-ended questions. Or if you ask a closed-ended question, just say pause. Actually, I'm going to try that again. I want you to actually do that. So ask open-ended questions, but really, really, really what I want you guys to be locking in on is reflecting affect, summarizing, recognizing those themes, points of entry, but really just I want you to really want the person to feel heard. Don't try that too hard, I guess. I'll actually pull that back. And I want you to check in with each other, right? Every so often, I want you to ask, am I understanding you here? Or am I a little bit off? And speakers, I want you to have the courage to disappoint your partner and tell them that they don't understand a damn thing that you're saying. If they don't, right, I want you to say, I don't think you really get what's most important here. Right? That's not a problem. That's just talking to another human. You don't have to understand perfectly, but I want you to really focus on just reflecting back affect, reflecting feelings, reflecting the things that you're hearing, summarizing. That's the gist. We'll see. We'll do helping clients with their feelings seems like a little bit lower hanging fruit. So the topic that I kind of want you all to focus on is the chapter exercises. Which feeling is most difficult for you to approach in your clients? What makes this feeling difficult to approach? How is this feeling responded to in your family of origin? You do not need to, if any of that feels like too evocative or feels like you don't want to share that, just talk about something else. You don't have to like be evasive, but just say, hey, I don't want to talk about the prompt that John Paul just gave because it scares the hell out of me. And then just talk about something that's frustrating you this week. Cool. Which feeling will be most difficult for you to approach in clients? What makes this feeling difficult to approach? How was this feeling responded to in your families of origin? So really, which feeling is most difficult for you to approach in yourself? I mean, that's really the question here for our purposes. And I'll be walking around. Also, if you guys are stuck, can you just raise your hand and say, John Paul, I'm stuck. Can you come help me? I'll be moving around, but it's hard to get to everybody. But if you're at a stuck point, just holler and call me over, okay?
Are we, so if we're focusing on what feeling is most difficult to approach, is that what we're focusing on as we're talking as the client or as we're listening as the therapist?
As we're talking as the client. Okay, both, but mainly I want you also to respect each other by kind of following where the client's leading. You can make process comments. It seems like it'd be scary for us to talk about this right now. It might be hard for us to talk about because we don't really know each other. Whatever it is, if there's a process comment to make, you can make it. But really just focus on reflecting. Yeah, I think.
Is this more like when you start your therapy session, should we open up like with how does being here feel for you today? Like is that what you kind of want? Or do you think we just make it our own thing?
No, this is not a therapy session. It's just a listening exercise. But if you would like, that would be a fine place to start is how will it feel for us to talk about this? That'd be a fine place to start if you'd so desire. Other questions? Cool. Do we have even numbers, odd numbers? I think we're even. Okay. Go.